All right, let's talk about something, well, every pet owner knows about it. Diarrhea. It's probably one of the top reasons we rush our animals to the vet, right? And when we get there, our brain often jumps to one solution: antibiotics. But what if that gut feeling, that first instinct, is actually wrong?
I mean, it's almost a reflex, isn't it? You think, okay, something's off in their tummy, must be some bad bacteria, let's just get an antibiotic and knock it out. It feels so simple, so direct. But here's the big question. Is it actually the right thing to do? And bam, right out of the gate, we hit a wall, a big one, from the experts. See, most gastroenterologists are really starting to push back on just handing out antimicrobials for diarrhea. And you have to ask, why? Well, it turns out the cure can sometimes be the cause of the problem. Yeah, you heard that right. The very medicine you're reaching for to stop the diarrhea can sometimes be the thing that starts it. Think about it. Antibiotics are like a bomb. They don't just kill the bad bacteria, they can wipe out all the good, healthy bacteria in the gut too. And when that happens, the whole system gets thrown out of whack. So the takeaway here, this is way more complicated than it looks.
Okay, so if we can't just use them all the time, that brings us to the most important question, right? When should we be using antibiotics? This is where veterinary medicine has to get really smart, really precise. We've got to shift from this let's just try it routine to a much more focused, this is absolutely necessary approach.
So, what does that targeted approach even look like in practice? Well, let's dive into a perfect real-world example. A pretty specific condition called ulcerative colitis, which we see a lot in boxer dogs. Now, in this case, things are crystal clear. We know exactly what we're fighting. There's a specific invasive type of E. coli that gets into the colon and just causes this massive inflammatory reaction. And because we have a known bad guy, we can pull out a specific weapon, an antibiotic called enrofloxacin, and it works. We're talking up to 9 weeks of treatment, but it's effective. That is what targeted therapy is all about. And check this out. Here's another really fascinating case. It's a condition that's literally named after the drug that fixes it, tylosin-responsive diarrhea. What's so interesting is that with this one, vets might not even be able to pinpoint the exact bacteria causing the trouble. But what they have found, through experience, is a clear pattern. You give the dog tylosin, and it gets better. And this just drives home how specific we have to be. The response to tylosin can be incredibly quick. Sometimes you see improvement in just 24 hours. But here's the kicker. Studies have shown that other common antibiotics, like metronidazole or doxycycline, they just don't work for this particular syndrome. It's proof that it's not about just grabbing any antibiotic off the shelf. It's about finding the one right key for that one specific lock.
All right, so with that in mind, let's kind of open up the vet's drug toolkit and take a closer look at a few of these key players. We'll start with one of the most common ones you've probably heard of. So, first up, metronidazole. Yeah, if you've been to a vet for tummy troubles, you've probably come across this one. It's a real workhorse in veterinary medicine, but its job in treating diarrhea is way more specific than you might think. So, let's break it down. Metronidazole is pretty versatile. It's great for fighting off things like protozoa, tiny single-celled critters like Giardia, and it can also help calm down general inflammation in the bowels. But look closely at the details here. The dose for a dog is different than for a cat, and there's a super practical heads up. Cats think it tastes awful. Little things like that, they really matter. And honestly, those details aren't just for convenience. They're about safety. This is not a drug you want to mess around with. If the dose gets too high, we're talking over 60 milligrams per kilogram per day, it can cause some really scary neurological side effects, like tremors or even seizures. It's a powerful reminder that getting the diagnosis and the dosage exactly right isn't just about making the animal better. It's about making sure you don't accidentally cause more harm. Let's dial in the focus even more. Okay, say you have a cat with diarrhea. Your first thought might be metronidazole. But what if the culprit is a different protozoan, a nasty little one called Trichomonas foodus? Well, in that case, metronidazol's cousin, ronidazole, is actually the go-to drug. It's just flat out more effective for that specific bug. See? Two very similar drugs, but one is clearly the superior choice for a very specific target. Okay, we've been talking a lot about our pets, dogs and cats. Now let's pivot and look at larger animals, calves, pigs, and foals. Because when you get into production animals, the same principles apply, but the rules of the game and the stakes can change dramatically. When you look at treating calves, things get, well, surprisingly messy. You've got a whole list of oral antibiotics that are technically approved, but guess what? Some of those approvals are from like 50 years ago. They're ancient. When we look at modern, well-controlled studies, only one on that list, amoxicillin, has actually been proven to work. And to make things even crazier, some of the drugs that we know are effective, like fluoroquinolones, are actually banned by federal regulations for this specific use. It's this wild intersection of old science, new science, and the law.
And this right here, this example with foals, might be the perfect summary of everything we're talking about. Look at this. On one hand, you have diarrhea caused by Salmonella. In that case, you actually avoid antibiotics because they can make the foal shed the bacteria for even longer. The focus is on fluids and support. But on the other hand, if the diarrhea is from something called Lawsonia intracellularis, antibiotics are the #1 treatment. We're talking tetracyclines, doxycyclines. So you have the exact same symptom, diarrhea, but the treatments are polar opposites. It all depends on the cause.
So we've gone from boxer dogs to cats to calves and foals. After all these different examples, what's the big picture? What's the path forward for using these incredibly powerful drugs in a way that's both smart and responsible? Really, it all boils down to one crucial point. Effective treatment has to be targeted. It can't be general. We have to get out of this habit of just throwing a broad-spectrum antibiotic at a case of diarrhea and hoping for the best. The real goal is precision. Figure out the specific cause and then pick the exact tool that's built to fix it. And that means we have to avoid what the source material calls irrational combinations of drugs. You know, the old shotgun approach. Just fire everything at it and see what sticks. No. The foundation of any good treatment has to be a good diagnosis. That could mean finding the exact pathogen, or it could mean recognizing a specific pattern, a well-defined syndrome. And that brings us to the biggest issue of all, the one that hangs over everything we've talked about. This is so much more than just a cool medical puzzle. Every single time an antibiotic is used when it isn't needed, it contributes to the global crisis of antibiotic resistance. A targeted approach isn't just better medicine today, it's our best strategy to ensure these life-saving drugs still work for the animals who desperately need them tomorrow.